Well, I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana, also one of the co-founders. And each and every Wednesday, we take a topic and we talk about challenges that you may have on the line, or maybe you know someone that may have a challenge that we discuss. So it's really, really great because we kind of dig deep in the data and the research, and we kind of find out that what we're going to talk about, which is CBD tonight, has lots of medicinal benefits. And we kind of tie these things together. We talk about our products at the end, and then I take questions. So tonight, we're going to be talking about CBD and epilepsy and seizure disorders. I think that I don't know how I've done this, but I don't think I've ever talked about this topic. So if I did, maybe you guys can remind me. I'm AARP mind going on here, but CBD and seizures or epilepsy as well is one of the top reasons that, along with pain, that people seek the use of CBD. So what is epilepsy? I think tonight you're going to learn that epilepsy and seizures are not really the same. So epilepsy is a chronic disorder that affects the central nervous system. And it's characterized by abnormal brain activity. And that abnormal brain activity can cause recurrent and unprovoked seizures. These movements that we see epileptics have are their uncontrollable convulsions, jerking of the arms and the legs. So sometimes these symptoms are temporary and unexplained confusion. Sometimes you may see those who have epilepsy like stare off in space. And sometimes they may just fall to the ground. Part of the motor cortex of the brain doesn't allow them to have control over movement. So epilepsy is versatile. It's a versatile condition, meaning that it can range from very mild symptoms where individuals' quality of life or their day-to-day activity is not affected. And many times it can be extreme. It can be so extreme that the symptoms are so severe that it really prevents individuals from engaging in normal activities. And potentially, the extreme and severe symptoms can result in brain damage. When I started my journey in 2015, my weight loss journey, I joined a gym and the owner had epilepsy. And it was really fascinating that she was determined not to allow her symptoms to affect her passion. And so I remember that when I joined in 2014, I didn't know about CBD at all during that time. But years later, I introduced the owner to CBD because in her gym, you couldn't even drop or remotely drop a weight. Or you know how you're on the machines and you let the weights kind of clang together? You couldn't do that because those sort of sounds would trigger her to have a seizure. So it can be very extreme where the quality of someone's life is really, really impacted. And so I was so happy that she was like one of my first customers with introducing her with CBD. So it can be very extreme or it can be very mild. So the diagnosis of epilepsy is usually done by an EEG, where we're measuring the brain activity or the electrical activity in the brain. And just think about epilepsy like you're on I-57. If you live in Chicago, you've got 57 South and I-57 North. And the normal activity in the brain is, the south traffic's going south and the north traffic is going north. But In epilepsy, what happens is that there's no abnormal activity. So you've got some people going on the wrong way, right, on I-57. You got some people that are trying to turn in the middle of the highway. And so this abnormal activity causes abnormal movement because the motor cortex, again, of the brain is mostly affected in epilepsy. It's a part of the brain that coordinates movement, voluntary movement. So let's move on to seizures. So we talked about epilepsy as a chronic disorder of recurrent activity, abnormal activity in the brain. Well, seizures are abnormal surges. It's not something that's chronic. It can be due to chemicals and changes in the nerve cells. But what we see is an imbalance of excitatory and inhibitory brain cells. So should be a balance, but in seizures, sometimes there's too much or too little activity in the brain. And this is really important when we really talk about the significance of the endocannabinoid system, right? We talk about homeostasis or balance. So this is the newest classification of seizures and the type of seizures that you may find. You may find people that have focal onset. That means that they can have a seizure and they're aware of what's going on. Or they may be impaired. They may be staring off into space, and then seconds later when you ask them what happened, they have absolutely no idea. It's almost like they were in a dream. And then there's something called generalized onset. That is the classical tonic-clonic seizure where the entire body is jerking or the arms and legs are jerking. And these patients typically are not aware at all. Sometimes they lose continence, they lose control of their bowel and their bladder. And then there's unknown onset. An unknown onset also is more of a tonic-clonic motor symptoms that you may see in patients. There is classifications that break down generalized versus focal. Again, generalized, when you talk about a generalized seizure, it's affecting the entire brain. All the parts of the brain are affected. They, again, are unconscious. They lose control of voluntary movement. They typically, lose control of their bowel and bladder. Whereas focal, it's just one area of the brain. And that person may have impaired consciousness or they may be fully aware. So a person could be talking to you and have a seizure, and you may think that they're just pausing in between of sentences. That used to be called, when I was back in medical school, a petit mal seizure, right? Where they're mostly staring into space. So these are the different types of generalized seizures. Remember, the generalized seizures affects all areas of the brain. So you may see patients or friends or family that have what we call myoclonic, and that's the jerking or twitching of the arms and the legs. And I want you to really pay attention to symptoms, right? Because when we talk about our products, you may ask, well, why would a patient or a person that has seizures need our topical products? Why would they have pain? Well, they have a lot of pain because when they have a seizure, their entire body is affected. Their muscles tighten, they're jerking, and many times they fall to the ground. So they have pain, physical pain as well. Tonic generalized seizures. Again, there's a sudden stiffening of muscles in the legs, in the arms, in the back. Many patients with tonic seizures fall to the ground. Again, when we talk about our topical products, this becomes important. Tonic-clonic, again, they lose consciousness, uncontrollable shaking, they lose control of their bladder, their bowel, and sometimes they bite their tongue. So many times you will see where we have to put either some protective mechanism so they don't bite their tongue during a seizure. Now, the absence generalized seizure is that person who looks like they're just staring off in space. You would never even know that they're having a seizure, right? They may have some subtle body movements, but typically it's that person that looks like they're just daydreaming. Clonic, that is repetitive, rhythmic movements in the muscles. Typically it's the arms, the neck, and the face. And then the atonic, those are really serious. This is when they lose all control of their muscles and they fall to the ground. So generalized seizures affect the entire brain and all areas of the brain, and they can cause a lot of physical pain. Again, the focal seizures or partial seizures affect one part of the brain, not all areas of the brain. So whatever area that it affects, those symptoms would be very evident. It may be affecting their emotions or their perception. It may be affecting their consciousness, them being aware of their environment. They may have a seizure and not remember anything that you said to them. They may have repetitive behaviors like swallowing or rubbing their hands together. So what are some of the causes of seizures? I'm an obstetrician gynecologist of over 30 years, and one of the common reasons, causes of seizures that I see are in babies who are born with a lack of oxygen during birth. This weekend, I was on call and a woman had a baby at home. But the unfortunate part about her having her baby at home was that her baby was severely premature. It was a 26-weeker. We all know it's 40 weeks in pregnancy. So that 26-weeker, by the time that baby was brought in with the mom via ambulance, that baby had had at least an hour of lack of oxygen during birth. So unfortunately, that baby is at Stroger Hospital having repetitive seizures. Other causes of seizures is infections. You may have heard that some children have febrile seizures. Also infections such as meningitis. Causes of seizures can come from someone having a stroke or brain damage, dehydration, exhaustion, illegal drugs like cocaine or ecstasy, or maybe you just forgot to take your seizure medication, and that can cause seizures as well. These are some of the signs and symptoms of seizures. Again, they can be as evident and obvious as uncontrolled jerking movements. I think we all think of seizures as someone uncontrollably jerking, but they can be very, very subtle. Someone just confused, someone that's looking like they're staring into space. They also can have an aura. Many patients that have seizure disorders know before they're going to have a seizure. It's almost like the aura that many folks who suffer from migraines have. There can be a sudden fall where they just fall to the ground. Why? Because the abnormal activity is affecting the motor cortex of the brain that controls movement. They could have loss of consciousness or awareness, or maybe just have a very strange sensation and emotions. So there's a lot of studies that say that we have found that CBD is a product that can assist and help to reduce seizures. In fact, this study found that the addition of CBD helped reduce seizures in nearly 37% of patients, and 2% of patients reported that they were free of seizures entirely. So we're going to talk about what CBD is, but cannabidiol has been studied, and it's been found that it has anti-seizure, antipsychotic, neuroprotective, antidepressant, and anxiolytic benefits. So the neural protection is also a reason why CBD has been so effective, as well as its anti-inflammatory and antioxidative properties has been so effective in patients who have seizures. So let's look at the cannabis plant, because you may be a guest on the line and you really need to understand what CBD is and where it comes from. So when we talk about the cannabis plant, there's two species. There's one species called marijuana, and that's the species that has the euphoria, the paranoia to it, the psychotic components, because it has high levels of THC. THC is the compound that gives you the high. And then the other species that the marijuana or the cannabis plant produces is called hemp. And hemp is the non-psychoactive part of the plant. So our CBD products and our CBD portion of the plant is coming from the hemp species. So it has very trace amounts of THC. In fact, hemp is defined as containing 0.3% or less of THC, and it has high amounts of CBD. So CBD from hemp is the health without the high. And who brought this really to the forefront, mainstream, was Dr. Sanjay Gupta in 2013, 2014. And what Dr. Sanjay Gupta did was that he really did his research. He did his due diligence as a physician to really look at the medicinal benefits of the plant. And what he found in 2013, 2014 was a little girl by the name of Charlotte Fiji. And this little girl has a syndrome that is called Dravet syndrome. It's a syndrome where children have between 300 to 500 seizures a week, not a year, a week. And this little girl was introduced to CBD by her mom and dad. They exhausted every treatment possible for her. They were really on the verge of having her undergo brain surgery to somehow remove the electrical or the abnormal part of the brain that was sending off these abnormal electrical currents in her brain. So she was introduced to CBD in 2014, and Dr. Sanjay Gupta was able to meet her and her parents, and that's when he came back and made a public apology by saying that we have systematically been misled about this plant. We didn't do our due diligence about this plant. This plant has helped thousands of children and adults who have epilepsy and seizure disorder. So unfortunately, Charlotte Fiji died. She passed away last year from complications due to COVID-19. It's important to know that even the FDA commissioner, Dr. Scott Gottlieb, approved one of the only CBD medications, Epidolax, for children who have Dravet syndrome. And this has led to now the FDA being more open on studying more. This is a synthetically made product, but it is sourced from CBD, Epidolax. So let's look at CBD. This may be a little blurry for you, but just listen to some of the medicinal benefits that CBD possesses. Not only is it great as an anti-epileptic, anti-inflammatory, antioxidant, anxiolytic, helping with anxiety as well, but it's an antibacterial. It helps to inhibit cancer cell growth. It helps to promote bone growth. It reduces the risk of arterial blockage. It reduces inflammation. In fact, CBD has thousands of medicinal benefits that, along with the cannabis plant, has been studied for centuries. In fact, since 2737 BC, this plant has been shown to be of benefit medicinal. Now, there's other parts of the plant that are important that you should know about. Not only CBD, though it has more medicinal benefits than any of the other parts, but CBG and CBC and Delta 8 THC, all of these compounds or cannabinoids that the plant makes synergistically really helps those who are looking and challenged with seizure disorder and epilepsy. So how does CBD work? How does it work in those who have epilepsy? Well, it works through something called the endocannabinoid system. And this system is responsible for maintaining balance. We talked about how in the brain, in those who have epilepsy, there is an abnormal current. Not everybody is going south on I-57, right? Some people are going north on I-57 south, and some people are trying to go east on it. So there's an abnormal imbalance in the brain that's occurring. So what CBD does is that it binds with the receptors that are found in the brain and the central nervous system. In fact, these receptors are found in every single organ and gland in our body that help put us back in balance when we consume CBD. So there are specific receptors that are found in the brain that help the electrical activity that's out of balance to be put back in balance. And that's how CBD works. There's real science behind how it works. Now, last night I talked about this. This is really important that you understand that the normal binding of receptors normally is from the presynaptic area to the postsynaptic area. But in the endocannabinoid system, it's the reverse. It's called retrograde. It's called retrograde transmission. Couldn't think of the word. Retrograde transmission. And what that means is that when you consume CBD, the reason why it works so well in seizures, the reason why it works so well in anxiety, the reason why it works so well in hyperactive sort of conditions is because the CBD binds on the postsynaptic neuron and then travels and sends a signal to where all the hyperactivity is. And all the hyperactivity is in the presynaptic neuron. So in the endocannabinoid system, it is a retrograde. It goes upstream. So it reduces the electrical hyperactivity in those who have seizures. It helps to reduce the hyperactivity in those who have ADHD or anxiety. And it is the science behind how CBD works. So hopefully you have a better understanding on epilepsy, on seizure disorders. You know, there's many drugs that we use for seizures. The list is long, but we're going to talk about a couple at the end that potentially could have drug-drug interactions with CBD. So let's talk about our products here at Wakana. We have many products, and we're going to talk about many of them tonight. But first, the disclaimer is that these statements have not been evaluated by the FDA. Again, the only FDA approved CBD medication is called Epidiolex, and it is a synthetically lab-derived manufactured drug, right? It's not a pure form that we're speaking about today that comes from the hemp species. Also, it's important to know that these products should not be used or sold to persons under the age of 18, and also our vape products should not be used or sold to persons under the age of 21. So there's different ways to consume CBD. There's tinctures, there are vapes, there's topicals. They even have supplements or pill forms, and then edibles. So let's talk about our tinctures here at Wakana. Our products are very unique in that our products they have a proprietary formulation. meaning that we just don't have a bottle with CBD in it. We've enhanced our CBD products with essential oils because we understand the healing properties of essential oils as well. So our tinctures are products that you place underneath the tongue. You ensure the highest amount of absorption by holding the oil underneath the tongue for 60 seconds, right? And that's really important so that those glands underneath the tongue can absorb the CBD so it can be absorbed in the bloodstream within 15 to 20 minutes. So our Hempranium 500 milligram product on the far left, that is one of our top sellers. That's a product you would use twice a day. When we talk about CBD, more is not better. You know, you may have someone in your family, someone you love, or maybe you're on the line and you're on multiple medications for seizure disorder, or you have epilepsy. More is not better. Most people with epilepsy don't need any more than 25 to 50 milligrams at one time in one 24-hour period. So 3 drops in the morning, 3 drops in the evening of our Hempranium 500 milligrams will give you about 10 to 12 milligrams of CBD on a daily dose. It's a great, great starting dose. More is not better. Start low and start slow. Why do you say that, Dr. Rita? Well, because if you give someone too much CBD all at one time, you're at risk of having a side effect of being excessively fatigued, or maybe a headache, or maybe a little nausea. So starting low and starting slow is a great, great way to use our products. We also have products that can be used in those who have random drug screens. Those are our pure products. I failed to mention that our power products, those are all the products that not only say the word power, but they have a black label. Those are products that are full spectrum. They contain the legal limit of THC, which is 0.3% or less. And those power products should not be used if you have random drug screens at your job. You would use that pure product, which is the next product. It has a white label. These are broad spectrum products that contain less than 0.0% of THC, and they can safely be used if you have random drug screens. Again, 3 drops in the morning, 3 drops in the evening is a great, great starting dose. We have a product that you can infuse in your water, in your juice, in your smoothies. That's our Power Water Soluble, because we know many times if you are dealing with someone that cannot always hold an oil underneath their tongue for 60 seconds, they will do better with that water soluble product. We also have products that are great for when you bake and you cook. We're going to talk about those in our edible section. So our smokables are next, because smokables are an opportunity for you to get the CBD into the system very, very quickly. The gym owner that I talked about, she would have these focal staring sort of seizures. And so what she would always have on hand would be a cartridge. So when she would start to feel the aura, remember we talked about the aura, some people can feel when they're about to have a seizure, she would use her cartridge and take 1 to 3 pulls on that vape cartridge, and that will help her to decrease her from having a seizure. So these are products that work within 1 to 5 minutes. They're fast acting, and they're absolutely a great way to use CBD in those acute settings when you have either an aura or you know that you are in a situation that potentially could trigger your seizures. Like she was a gym owner, and maybe sometimes she would see me let that weight down too fast. Well, just the sound of that weight hitting each other could trigger a seizure. We have spices. Our spices, again, are products that are part of the edible line because you can use in your food. We have a butter that you can use as well. These products are infused with CBD. They are power products, again, with the black label. So if you have random drug screens, these are products that you want to stay away from. You want to use our pure tincture product that we talked about before. Our spices are infused, they're not coated. Our butter is vegan, non-GMO. Just a great, great way to enhance in ingesting, a different way to ingest CBD. Now, our edibles include our gummies, which are a great, great way to get CBD in your system. Gummies take about 60 minutes to get into the bloodstream. So I love recommending using the gummies at night before you sleep. Using the gummies at night before you sleep not only help you get that restorative REM sleep, but again, puts the body in balance, puts that electrical activity in the brain in balance. So our power gummies, again, are for those who do not have random drug screens. And then our pure gummies, our broad spectrum gummies, are for those who have random drug screens, and that is an option for you along with the tincture. The next product here is the Culinary Plus, and the Culinary Plus is a great product because it allows those who like to bake, who like to cook, to use them in different recipes as well. Topical products, I thought that this would be a really good reminder that those who have seizures, those who have epilepsies, they have pain in different areas of the body, typically their arms, their legs, and their back, and their neck. When you have tonic-clonic seizures, it involves the entire body. Many times they will have seizures where they will fall. Many times they will have seizures where the entire muscle area tightens up. So our topical products are products that offer local relief. Our Power Extreme, our 400 or 200 milligram. We also have a Power Relief Topical, which is 500 milligrams. And on the very far right is our Dr. Rita's Rub. These are all topical products specifically to offer local relief to those areas. Now, because topicals do not pass the blood-brain barrier, these power topical products can be used if you have random drug screens. So just remember and know that any of these topical products will not pass in the bloodstream. Now let's talk about drug-drug interactions. You may be on the line and you may be on some medications for seizures like clobazam, lamotrigine, valproic acid. Those are 3 medications that we use for seizures that may have a drug-drug interaction with CBD, meaning it may potentiate the effectiveness of this medications that you're taking, or it may inhibit or lessen the effectiveness of the medication. So it doesn't mean that if you're on these medications that you can't take CBD. It just means that your physician needs to know that you're taking CBD. Your physicians may want to get more often visits or maybe blood work to ensure that the levels stay within normal range. Other medications that potentially could interact with CBD include a blood thinner called warfarin, a heart medication, amiodarone, and a thyroid medication called Synthroid. These are all medications that potentially could cause a drug-drug interaction. So always, if you're on medication, if you're under a doctor's care, always, always, always talk to your physician. So I think that's it for me. I think that is the end of my slide presentation, and it is. If there's any questions, you can put those questions in the chat. But just know that we cannot make any claims that CBD will cure, prevent, or mitigate any symptoms that you may have due to your seizure disorder or epilepsy. Just know that the science is there. The science shows that the endocannabinoid system is a system that has receptors to help to keep the brain activity that is abnormal or out of balance back in balance. That CBD has been shown in research to be a anti-epileptic. It helps with anxiety. It helps to reduce the hyperactivity in the brain. And also the studies show, just from that little girl by the name of Charlotte Fiji, that it can be very effective in Dravet syndrome and other childhood seizure disorder. So with that being said, let's see if there's any questions. Dr. Tyus is on the Medical Advisory Board. Welcome, Dr. Tyus. We have Dr. Betty, Dr. Rashonda Conte, and we also have, I guess, Dr. Cuzzo. Dr. Cuzzo and Dr. West, Desi West are on as well. If there's any questions, please let me know. Yes, it's Women's History Month, and I forgot to highlight a physician in medicine this evening. You guys forgot to remind me. There's 3 people that have raised their hands, but I don't see a question. So just type it in the chat box. And I think it's important to remember that if you have a loved one, a family member, a client, a customer, a prospect that deals with challenges due to seizure or epilepsy, just know that there is a lot of data that you can offer and share with them just by using your favorite search engine and putting in CBD and seizures. Lots of studies have been done on CBD and THC as it relates to seizure disorders. I guess there's no questions tonight. You want to say anything, Dr. Crawford?
No, I think you covered everything.
So someone's on heart medicine twice a day. Will that affect me taking the gummies for sleep? Tracy, it's really important that you talk to your physician whenever you are using CBD with other pharmaceutical medications. You know, our PharmD, Dr. Joy Smith, always recommends that you space your medication at least 1 to 2 hours apart. So always talk to your physician. We are not, you know, the FDA doesn't approve us to make statements or to make medical recommendations as it relates to your medication. So speak with your physician, you know, make sure that your physician is engaged with those who are on medications under a doctor's care. Always talk to your physician. A daily regimen for those who have seizures. Yeah, I would recommend a daily regimen of tinctures twice a day, the gummies at night, and also having that fast-acting, smokable, having a cartridge at all times on hand. So tincture, 3 drops in the morning, under the tongue, holding it for 60 seconds before you swallow. 3 drops in the evening, holding it under your tongue for 60 seconds before you swallow. A gummy at night, about 30 to 60 minutes before you sleep, and having that cartridge at all times on hand for those who may feel an aura before, so that they can really abate that seizure from happening. So whenever you want to find information on CBD, someone's asking about thyroid and hormones, absolutely you can use your search engine. Type it in CBD and thyroid CBD. I just did CBD and hormones last week. So Zeb, whoever invited you to this webinar, can get you those recordings. What if you have a feeding tube and can't use the gummies? So if you have a feeding tube, then what would you recommend, Dr. Crawford?
I would probably think about the water soluble. Perhaps if it's mixed in whatever they're putting in with the feeding tube, is it that if they can't use anything orally?
Yeah, so that's a really, really complex question,
Right.
and we are not your physicians. So if someone has a feeding tube, that's really a question for your physician.
Yeah, if they
Tube,
can't,
I would
yeah,
stick with a topical or a smokable, right? Somebody with a feeding tube can use a vape cartridge.
right.
I think those are all the questions. Let's look at the Q&A area. No questions there.
It looks like
Wonderful.
Margaret asked if there were any cases where anyone's ever been healed from having seizures or epilepsy.
The only case that I know about is a little girl by the name of Charlotte Fiji. She was having 300 seizures a week and went down to 3 seizures a week. So there's a lot of studies out there on seizure disorders and CBD. So all you have to do is Google it, do your due diligence. But epilepsy, seizures, is one of the most studied medical condition as it relates to cannabis plant. Most studied. So you can find a lot of literature.
Okay.
Yeah. So, you know, we can't make claims of healing. We can share with you data information. You can absolutely email me at ritamd@wakana.com. I can share with you lots and lots of data and studies to exhaustion, right? So there's my email there. Oops, I did it to the panelists. So ritamd@wakana.com. Perfect.
Dr. Rita?
Wonderful. Yes.
Thank you for having us on, number one.
Oh, you're welcome.
Happy Women's History Month. Definitely. I love that. Dr. Tyus, I love it.
Don't you love that? She has
I
the
love
coolest
that.
backgrounds ever. She never
Indeed.
shares them with me though.
Dr. Rita, I love the presentation. It hit home for myself talking about warfarin. My mom uses that as well as Coumadin. And could you just speak a little bit into that, how we don't want to mix the two, definitely, but how we can get it done?
Right. So warfarin, Coumadin, is a blood thinner. And there are blood markers that we check on patients who are on Coumadin. It's called an INR. So the INR needs to be in a certain range to show that that medication is therapeutic, that it's working well. So when you use CBD, it's metabolized to the same pathway as Coumadin is. It's metabolized in a special pathway in the liver. So when you're using Coumadin and CBD, one, your doctor is going to want to check those levels more frequently. And then two, you want to space out when you take your CBD and when you take your Coumadin. You want to space it out about 2 hours. So it's not that many of these drug interactions you can't use CBD, but your doctor needs to know about it so your doctor can monitor your levels. That's what it means, right? So if you're on a medication, that CBD makes your medication work less, your doctor's going to be like, why is it that your blood sugar is so high? Or why is it your blood pressure is so low, right? These are just examples I'm making up. That's why it's important you let your physician know that you're using CBD, because then they know how to titrate, decrease, and maybe even take you off of your medications that you're on. So engaging your physician is not a bad thing. Engaging your physician is a good thing, because one, it allows your physician to learn about CBD, which all physicians and healthcare providers should know. And two, it allows you to be more active in managing with your physician your health. It's your body and you have choices. And your choice may be to take a holistic route to improving your health. Your choice may be to include CBD to improve your health. That's your choice. And along with your physician's, monitoring, we see a lot of patients that have improved along with diet, along with exercise, along with lifestyle modifications, get off medications and reduce their medications.
Thank you.
You're welcome.
Good evening.
Good evening.
How are you?
I'm good. I'm good. How are you, Dr. Betty?
Wonderful. Just awesome. Thanks. That was a great presentation. I just wanted to speak to the person that asked about someone who had a feeding tube. So
Yes.
if you might not want to use any of the products internally until you've spoken with the attending physician, the skin is the largest organ in the body. And you can always go to the feet and to the hands, because in the feet and the hands, all of the nerves in the body end up in those places. So, especially if the person might be having some seizures, just by gently rubbing the oil or lotion on their feet and hands can actually have a very calming experience and could either waylay a seizure or calm them down some. So that was it.
See why we have the best medical advisory board in the world. Exactly what Dr. Betty said. The skin is the largest organ. And I'm telling you, you want to absorb something, you rub it on your feet. The soles of your feet have the largest pores. I do that, Dr. Betty, with my peppermint. When I need energy, I take that peppermint and I rub the soles of my feet, and I have energy for the entire day. So great comment. Great recommendation. The skin is the largest organ. So with the feeding tube, absolutely, that would be phenomenal to use that route of using your CBD. Thank you.
Not to mention that the sense of touch is of the utmost importance. And many times when people are in those situations, they don't really get touched that often. So that's an added plus in terms of therapeutic behavior.
Wonderful. So Erica Zachary, did you want to make a comment? And Margie, I'm going to have you email me about blood pressure and hyperthyroid. We just want to stick to the topic, which is seizure and epilepsy tonight. But feel free to email me. Erica, did you have a comment? I was reading.
Hi, Dr. Rita. Yes, I'm not even sure if this falls in the same classification, but pseudo seizures. So
Mm-hmm.
I know it's considered a mental health disorder, but I don't know if it falls in the same realm as these other seizures, if that makes sense.
Yes. Tell me about how you helped someone with their pseudo seizures.
So that was actually many years ago, but we had to figure out that that's what it was because she was
Ah,
having seizures, and I can't remember what type of seizure which one that you shared that they would just kind of she would just be staring into space. You didn't really know whether she was here or not. There was some other, it was a lot going on with her, but she was at the time definitely very depressed, very anxious. And so it seemed like it was connected to that. And so I'm just thinking, I have not had a case like that since then,
mhm.
but I do remember it because she's a client. I ended up having very few clients I've had to do, um, oh my goodness, can't think of the word, uh, where I had to call for emergency help. I'm not thinking of the word
Ah,
now. But anyway, so I haven't had to do it often, but she was one of those clients that I had to do that with. But every time I went to see her, I would find her in that state where she just wasn't responsive. But it was stress related. So I don't even know. Does that fall into the realm of a regular seizure?
yeah. Well, I mean, that would fall in the realm of a focal sort of type of
Okay.
seizure where they're staring, and it could be triggered by stress. It could be triggered by seizures. Those focal seizures can be triggered by fever, dehydration, Dr. Rita dropping the weights in the gym, flashing
Oh, right.
lights,
That's right. Okay.
all of that stuff. Yeah.
Okay. 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 I was just trying to check if we would treat it the same way that we would do. Like I was thinking of it like a mood disorder or anxiety disorder, but pretty much starting with layering our products or layering CBD to be that seemed to me to be the best way to handle that.
Perfect.
Yeah.
Can I add something to that?
Please do.
Erica, I actually had a client once who suffered from pseudo seizures as well. And even though it is a non-epileptic seizure,
Mm-hmm.
the symptoms are still very similar. And so I would say, yes, the CBD would probably still be effective because those symptoms are brought on from the stress or depression or any other mental illness they may have. The CBD would probably, still be an answer or an alternative because we treated the clients that we have seen that has experienced that. We would treat them with antidepressants, any
Mm-hmm.
anti-anxiety medications. So the CBD would probably be truly an alternative for that as well.
Okay. Okay. Thank you. That's what I was thinking. I just haven't seen it happen often, but when I heard this come up, she's definitely a client I thought of.
Wonderful. So we are going to say good night. This has been a great, great discussion. We will have a recording for all of you in tomorrow morning. But I want to thank the Wakana Medical Advisory Board for really chiming in each and every Wednesday and Tuesday. If you're a guest on the line, you have additional questions, you can contact the person that invited you, get those questions answered, get those products ordered. We have amazing products now. We have an additional way of using some of these products with those who may have feeding tubes now, as well as we want you to get engaged with our Wakana movement, because we are a movement really to empower, to educate those who are looking for an alternative, a holistic alternative, organic alternative to their health. So I want to say good night. Thank you so much, Dr. Crawford, Dr. Conti, Dr. Betty Smith, Erica Zachary, Cuzzo, and Desi West. Thank you, business partners. Thank you, guests. Thank you. We'll see you the same time next Wednesday, 8 p.m. We'll talk about something exciting. We'll try to get a topic that I've not touched on. And the best way to do that is to, oh no, next week, Wednesday, we're talking about addiction. Thank you, Eric Strickland. We're talking about CBD and addiction. So we definitely have to have Dr. Conte in the house, but that is going to be our topic for next Wednesday. So anyone that you know that struggles with addiction, that has issues with addiction, please have them tune in next Wednesday at 8 p.m. So we'll see you all later. Be well and be safe, and good night.